Hey, today we're talking about dialectical behavioural therapy, or DBT. You'll learn what it is, where it came from, how it's delivered, and the four main components of DBT. At the end, I'll also share something helpful to consider if you're thinking about DBT for yourself. So what exactly does dialectical behavioural therapy mean? Dialectical refers to the idea of balancing opposites and finding a middle ground between conflicting ideas or emotions. For example, we can accept our emotions and choose a more constructive way to respond in a situation. And behavior therapy, that's all about understanding how our actions or behaviors influence our thoughts and emotions, and vice versa. Put them together and you've got a powerful way to manage emotions and improve relationships. Now, DBT was created by Dr. Marsha Linehan, a psychologist who had troubles managing her struggles with borderline personality disorder, or BPD. Linehan also worked with clients who were diagnosed with BPD. She saw the need for a more effective treatment for those struggling with intense emotions and self-destructive behaviors. Inspired by her own and her clients' challenges, she developed DBT. How cool is that? So let's talk about how DBT is typically delivered. Unlike traditional therapeutic approaches, DBT is often structured into skill-based group sessions, individual therapy, phone coaching, and therapist consultation teams. So I'll just tell you about each. Now, group sessions are aimed to offer a supportive environment where clients can learn and practice skills together. These sessions focus on teaching mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness, the four pillars of DBT. I'll explain a little bit about each after I've covered how DBT is delivered. So back to that. The next thing is phone coaching. This component of DBT provides clients with real-time support and guidance outside of therapy sessions, helping them to apply DBT skills in their everyday lives. Then we have the therapist consultation teams, which ensure that therapists who provide DBT are effectively implementing the treatment and receiving support themselves. These teams meet regularly to discuss cases, troubleshoot challenges, and enhance their skills. And then we have the individual therapy, where clients work one-on-one with a therapist to apply DBT skills to their specific challenges and goals. This personalized approach allows for a deeper exploration and problem solving, and DBT is sometimes delivered solely on a one-to-one basis as well. So I'm going to tell you the four main aspects of DBT. So how about you hit that subscribe button about now if you think this video has been useful so far. Even if you don't, it's about to be more interesting. So go on, just right there. So back to those four main components of DBT. These are the building blocks that form the foundation of a strong and resilient mindset. So yeah, we all want that. What are they? Mindfulness. First up, we're going to talk about this. It's about being fully present in the moment, tuning into your thoughts and feelings without judgment. For example, let's say you're spending time with your family, but your mind keeps drifting to work or some other pressure. With mindfulness in DBT, you can learn to acknowledge those distractions without getting swept away by them, helping you to feel more grounded and connected in the moment. Next, we'll talk about distress tolerance. So let's say you've had a really hard day and all you want to do is curl up on the sofa with some comfort food. Distress tolerance skills would offer you effective ways to cope with stress and overwhelm without resorting to unhealthy behaviors. It's like having a toolbox full of strategies to help you weather life's storms with resilience and grace. But on a side note, I'd say there's nothing wrong with the odd duvet day. In fact, I think it should be a part of all of our self-care regimen. But of course, everything in moderation. So the next one is emotion regulation. This pillar is like having a built-in thermostat for your feelings. Just imagine you're having a heated argument with a loved one. By learning emotion regulation techniques, you can more easily identify your triggers, pause before reacting impulsively, and choose more constructive ways to get your points across. It's about taking control of your emotions so you can respond in a healthy and balanced way. And then there's interpersonal effectiveness. This part focuses on improving communication and building stronger connections with others. Let's say you're disagreeing with a friend. By learning interpersonal effectiveness skills, you'll be able to assert your needs and boundaries while also considering the other person's perspective. It's about finding that delicate balance between standing up for yourself and maintaining healthy relationships. Now, as promised, here's some important information if you're considering DBT for yourself. Now, remember I said Linehan designed it with BPD in mind? Well, as you can probably gauge from the 4 aspects of DBT, this therapy has shown effectiveness in treating a number of mental health issues beyond BPD. That includes depression, anxiety disorders, substance use, eating disorders, and others. So this highlights DBT's versatility and potential benefit for anyone who wants to build a life worth living. So that's DBT in a nutshell. Whether you're looking to boost your emotional resilience, enhance your relationships, or simply live a fulfilling life, DBT has something for everyone. And remember, you can do DBT in the traditional sense or one-to-one.